Welcome. In this video, we'll be discussing a common yet often persistent eye condition, chronic conjunctivitis. We'll delve into what causes it, how it affects your eyes, and what you can do to manage it effectively. Join us as we explore the ins and outs of chronic conjunctivitis. Chronic conjunctivitis isn't caused by a single thing, like a sudden infection. Instead, it's often a result of ongoing irritation or underlying conditions. Common culprits include allergies to things like pollen, dust mites, or pet dander. Dry eye syndrome, where your eyes don't produce enough lubrication, can also contribute. Blepharitis, an inflammation of the eyelids, is another frequent cause. Less commonly, certain medications or even environmental factors like air pollution can trigger chronic conjunctivitis. Okay, let's talk about what's happening on a microscopic level. In chronic conjunctivitis, the conjunctiva, that thin, clear membrane covering the white part of your eye and the inside of your eyelids, becomes inflamed. Unlike acute conjunctivitis, which involves a sudden influx of immune cells, chronic conjunctivitis typically features a more sustained, lower-level inflammatory response. This ongoing inflammation disrupts the normal function of the conjunctiva, leading to persistent symptoms. In cases related to allergies, inflammatory mediators like histamine are released, exacerbating the problem. With dry eye, the lack of adequate lubrication causes constant irritation, fueling the inflammatory cycle. Chronic conjunctivitis is quite common, but its exact prevalence is difficult to pinpoint because many people don't seek medical attention for mild symptoms. It affects people of all ages, but certain populations are more susceptible. Individuals with allergies, dry eye syndrome, or blepharitis are at a higher risk. Contact lens wearers can also be more prone to developing chronic conjunctivitis, as can those who are frequently exposed to environmental irritants. The symptoms of chronic conjunctivitis, while similar to those of the acute form, are typically milder but longer lasting. You might experience persistent redness of the eyes, a gritty or burning sensation, excessive tearing, and mild itching. Some people also report blurred vision or a feeling that something is stuck in their eye. Importantly, unlike acute bacterial conjunctivitis, chronic conjunctivitis rarely involves thick, purulent discharge. Diagnosing chronic conjunctivitis involves a thorough eye examination by an eye care professional. They'll assess your symptoms, examine your eyes, and ask about your medical history, including any allergies or pre-existing conditions. Sometimes, a sample of your eye discharge may be taken for lab analysis to rule out infections or identify specific allergens. A tear film evaluation might be performed to assess for dry eye syndrome. The doctor needs to rule out other more serious condition mimicking the same. While there aren't distinct types of chronic conjunctivitis in the same way there are for acute infections, we can classify it based on the underlying cause. For example, we can have allergic conjunctivitis, which is caused by allergies, or dry eye-related conjunctivitis, which is caused by insufficient tear production. It's crucial to identify the underlying cause to tailor the treatment appropriately. Managing chronic conjunctivitis focuses on addressing the root cause and alleviating symptoms. If allergies are the culprit, allergy medications like antihistamines or mast cell stabilizers can help. Artificial tears are often recommended to lubricate the eyes and reduce irritation, especially in cases of dry eye. Proper eyelid hygiene, including warm compresses and gentle scrubbing, is essential for managing blepharitis. In some cases, topical corticosteroids may be prescribed to reduce inflammation, but these should be used cautiously and under the supervision of an eye care professional due to potential side effects. In all cases, avoiding trigger factors and irritants is crucial. Preventing chronic conjunctivitis often involves lifestyle adjustments. If you have allergies, try to minimize your exposure to allergens. Practice good eyelid hygiene to prevent blepharitis. Use lubricating eye drops regularly, especially if you have dry eye. When using contact lenses, follow proper cleaning and disinfection procedures. Avoid rubbing your eyes, as this can exacerbate irritation. If you know you have specific allergy to something, avoid the direct and indirect contact with that. The prognosis for chronic conjunctivitis is generally good, especially when the underlying cause is identified and managed effectively. Most people can achieve significant relief from their symptoms with appropriate treatment. While chronic conjunctivitis can be frustrating and persistent, it rarely leads to serious complications or vision loss. Recent research focuses on developing more effective and targeted therapies for dry eye and allergic conjunctivitis, as well as exploring the role of the microbiome in ocular surface health. This includes studies on newer artificial tears and immunomodulatory therapies. Also, research for new ways to deliver medication to affected area are in progress.